It is with great honor to introduce Dr. Al Glover. Dr. Al Glover is a board-certified podiatrist in foot and ankle surgery for over 30 years, whose diverse career offers a broader perspective of the profession, has developed integrated ideas about project management across departments, and the functional planning of clinical education podiatric surgical residency programs. Currently, Dr. Glover is a fellow with Climate Health Equity Fellowship affiliated with the Medical Society Consortium on Climate at George Mason University, Washington, D.C. At this juncture in his career, Dr. Glover has embraced a new professional challenge as executive coach at the Chicago School of Professional Psychology, earning certification in career development with an emphasis on diversity and equity training. Dr. Glover completed the prestigious California Healthcare Foundation UCSF Leadership Fellowship and 2020 where he has returned as a pod advisor from 2018 to present. His extensive background and experience gives him excellent academic, clinical, and practical expertise, which he generally shares with his residents and fellows to help them fulfill their leadership and educational requirements. Dr. Glover was a lieutenant commander in the United States Navy and head of the Department of Podiatry at Corpus Christi Naval Hospital. It was part of the U.S. Navy Rapid Response Team for global disasters from 1990 to 2004. Additionally, Dr. Glover has been a deacon at West Angeles Church of God in Christ in Los Angeles, California, and a part of the Brotherhood Healthcare Committee since 2009 to present. And finally, Dr. Glover has been a part of the Annual MiMentor board since 2020 to present. Without further ado, I'll like to welcome to the stage Dr. Al Glover.
Thank you so much, Joanna. I'm just blown away by the brilliance of not only our keynote speaker, Dr. Angulo, but all of the student leaders. It's just been inspiring. You know, my talk will be brief because, you know, we don't need to belabor. But one of the things that I was able to get involved with, as has been stated, I had the opportunity to be involved with a Climate Health Equity Fellowship out of Washington, D.C. with the Medical Consortium of Climate and Health. But what I was blown away by is the climate injustice and racism. So one of the things that we have to do, this is one of 10 presentations that I've have to present to members of the EPA and NOAA, and also the Natural Consortium on Rivers and Waterways here in the United States. But I wanted to talk about my own hometown, you know, here in Los Angeles. Where I live, we have oil wells. And one of the things that we have to deal with is the exposure of Black and brown communities to dealing with these extremely toxic and carcinogenic types of environments. When we start talking about social justice, one of the things that we have to remember is Black and Hispanic communities, we're disproportionately exposed to carcinogens and highly toxic chemicals that have affected our communities. And when I've talked to Sienna about some of the things that I want to try to do, we can go to the next slide. One of the things that we want to try to do is to start a climate and environmental task force within MiMentor. We want to get students involved. We want to get them to understand that we're not going to continue to take this type of environmental racism that we've been exposed to. I was very impressed with what Jimmy has talked about with equity. This is all part of the equity lens. You know, we've had to deal with these odors and pollutants for generations. And it's time to change. It really is time to change. And we have to make the change. Next slide, please. One of the things historically, we've been forced to live in areas that have always been near factories, near oil wells or gas drilling consortiums. And we've had to be pretty much relegated to redlining, which has been just a tremendous disadvantage to Black and brown communities for years, where we've been forcibly stuck in areas where we could not get out. And even with federal law banning redlining, the consequences are still here. So we're still dealing with a problem that we've been dealing with for over 50 years. Next slide, please. When we start indicators of vulnerabilities and inequities, they're structural. When we start talking about gas and oil, the types of things that we are exposed to, the serious threats surrounding our communities. One of those are the volatile organic compounds, or the VOCs. And they're these toxic brews of toxic gases along with methane, which is one of the most dangerous climate pollutant that we have to be exposed to. The other thing that we deal with is hazardous gas. And we deal with the petroleum-based gases known as BTEX, which are the benzenes, toluenes, ethylbenzenes, and xylenes. And these things are known carcinogens linked to leukemia and blood cancers. So we've been exposed to that. And what I see, even in my neighborhood, is we see fracking and this crazy, what we call slant drilling. So what they'll do is they'll say, okay, we've shut down this well, but we'll slant drill a mile or two underneath people's homes. And this slant drilling and fracking is affecting our groundwater, and ultimately it's going to affect our drinking water. Next slide, please. When we start talking about the consequences that we have to deal with, we have to talk about the respiratory complications. We talk about the wheezing and all that, but the chronic exposure is as dangerous to our lungs as breathing freeway air and secondhand smoke. And I know that a lot of our clinicians that are on the call, we're dealing with a trifecta. I deal with people who are living near toxic oil wells, they're living near freeways, and they're also living with people who smoke. So we're dealing with a double-edged sword. But one of the things that really strikes me here in the state of California is that African-American life expectancy is the lowest of all racial groups, and they have the highest rate of breast, cervical, colorectal, lung, and prostate cancer among all groups, followed by Latinx and other minority groups. Blacks have the highest rate of prenatal, postpartum depressive syndromes, preterm birth, low birth weight, infant mortality, and of course, what you've heard, maternal mortality rates. And these things are directly reflected to exposures to toxins and environmental contaminants. Next slide, please. One of the things that we have the benefit of is we live in a state that is trying desperately to change the narrative. Governor Gavin Newsom signed a landmark setback law in September. But one of the things that we're faced with and why we have to be vigilant and activists is the oil companies wasted very little time to try to start referendums to change the narrative, to see how they could get around being accountable. The setback rule basically bans reworking, repairing, and adding any new wells within safety zone areas. The one good thing that we have, and I'm very proud of, is that activists here in Los Angeles and the city of Los Angeles and the county of Los Angeles, they've set forth stricter guidelines. And I think that this is something that we need to lead with. We need to bang the doors down and make sure that people hear about what we're trying to do. Finally, next slide. One of the things that I saw when I was in DC is that the Biden-Harris administration has really tried to move the needle. In on Friday, April the 21st, 2023, President Biden created an Office of Environmental Justice that recognizes racism as a fundamental driver of environmental injustice. An executive order created an Office of Environmental Justice to coordinate environmental justice efforts across the federal government. The order presses agencies to close the gap of data and use specific research to understand and prevent damage to people's health brought by pollution. So what do we want to do? One of the things that I had an opportunity to talk with some of the heads of the EPA is we want to formulate what we call on the ground student leaders that will be climate justice warriors. And what we're trying to do, and I know Sienna is spearheading this, is we want to do op-eds, we want to do TikTok, we want to do all the social media platforms. We want to plug into people like Alex, who do blogs, and talk about what's going on in your community. You don't have to go far. No matter where you are here in California or wherever, there's something going on that is not right. Either there's a old closed factory plant or something that is exposing our people to these toxins. It is something that we've got to fight. You know, we see what's going on now in Congress, and what I worry about is they're trying to cut a lot of the safety net programs. We have to turn the needle by being activists. And the one thing that I love about being a part of MiMentor and meeting the young people here, I've never been so inspired, and I've been all over the globe by the young people in this organization and our leaders. This is what makes me so hopeful that we can change the narrative. And on that, I want to thank you.